Adeshima Maya Sheshia original TV so ya wada November bosmeda etoso mienu kakra na afie no kwa ne ko na wie no unim se ye hia ya wada se ya na yedidi ye ho enkomo ne ye hwe ye Ghana ha ba bia nsam bi esisi a sise ye de ebeto pete mu ma obia etibi no na ye de abro enti ensam sisi ya wada bia 4 to 5 p.m. na ye de abro original TV so me did asabia me da say da ne da nyina woje bre na 4 p.m. sharp otumi ehwe me pa cho ko Facebook na ko like page no na share page no na wana omundu fia omo ehwe online no omo so omo timi ehwe bi ye be makwan na wo so agye wadwenkyere we discussion as jumedi eba bedi hu ebiem no so no opese de comment so eba ko Facebook original TVGH na fa o comment ko to ho na yentimi eredi emfa maw na watwetwe mu no mede to wani mu se ye hwe ye da soa e ofra mantem ho ye hwe eye atoye nchama eto ye nuanom a ye wo ofra mantem me kire eye north ton south ton ene central ton timemufo a wo ho manka bi anhyemu a Water River Authority VRA wona ye yirem kanea no esi omo na so mapa no omo ebie eye omo ensuo bi a omo chese ados wo mu no enunti no ede atoye nchem kese pa ebre eye ye de bre eye wona omo wo sampotemu a ena no ye hwe nia ensunsuanso a ede aba ewo yadusia ensem ho ene ye hwe apomudin ensem ho ye betwa ye ho tew ne aba ye ba ye ne apomudinfo wona mo fra mantemu ene wona mo nkra he nyina bedi nkita ho ye report ho so asem we de chira chepa ewo fra mantemu no so ye ne no ebedi nkita ho na ya hwe emra so se ebimu ahya ase come back to omo location no then I mean measures and omo ede akwa yare bi entimi and break it out ema omo ho ensign enkoka yentu ye hotel ne embra sese a Abusia for ya samu akwa bason kokwa fe na wode we feed na to ha ya original TV and some city so na we ni gusu ahwe dwumede ya wade bia na onan kosi nonum ye chiemu na didi ye ho komo nsam bi etisi wo man Ghana mu na ye de abetu dwa na wana sese ye ne omo edi nkita ho fa ho no ye ne omo edi nkita ho wo so a wo hwe ye no na watimi so akye wa adwene ede afa ho emre so be ma kwan na wa frɛ wo hwe e online so amese like page na share page no na bo obi amane se unu aba asa bia nyame adom masan aba afidie kese so amenemo eba abedi juma yeda asepa se na meka ye no ene ye hwe apomudin sem ho ewo ye nuanom a omo aka ewo fra umantem ho obehwa se wo hwe visuals na eba ye na se wo hwe mfoni na eba ye na ya tese eye hupa na sabe omo agyanan nyina no ehohoro ye a ekọ omo fiefie awodro mu na ene no entia ya tene se ebimu ahya se omo ekọ bebia na omo te dada na ema eyesa ato ye nchemo no esi ye bisa enya na entia se adwumako beti se Zoom Lion fumigate those areas I mean Zoom Lion for that so unim se eba sa adwumadi se dia omo edimu akotene pa ewo manka untimi enka ho ni die nsem a onfa Zoom Lion embem omo akoye fumigate na so mako spray o ha sebe ema yare bia entimi baba e bisa is it enough na ene wona omo so omo ko back no yetimi the measures enough at two place a omo kwa some health break bi emma ebetimi ede atoye nchem foforo asan abraye nuanom a omo ewo sa framantam ne ebekọ framantam ne ya nam senior wo ho Gabriel Asempa edi nkita ho yede na edi nkita ho na watumi di amaye up to we onu ye obi a wedi dwumadie no asepa wedi eche pa ene me ne okasa ekura oda so edi echira ye hwe apomudin ensem eho ewo eye original TV so nti me ne okasa de ye wo doctor kuku dam ye nu ye ne omobedi nkita ho ba ko wo framantam ba ko de mpapa ba ko pe me ha ne sa bia wo ha adwen dodo na ma twe no ede aba eye studio ye kasi apomudin nsem de papa yi odi ni juma pa ewo abrochimemu UK abrochimemu ene Ghana ha nti anytime abeba holidays bia no na ya che no na one yen abecheche ensemu kakra ewo eye ne ekoso efa ya pomudin nsem ho Ghana ha say na me guest no na say me papa ye friend Dr. Richard Egan ono a global and public health consultant BBFA I mean apomudin sem bia no papa we ebetimi anyway di ho kita ho a obeboa pa doc good afternoon me da say wanya bread amaye
oh adai seja wo dey offer
I said nansen wo trendy o all the big health shows ni na what it is so esa na ma ye jealous kaka me say na mo use me papa yi sa
oh just say
for God and country
oh sir I know I can carry that here for God and country yes
right.
Yes for humanity
right
and tin sembi says here na che say o see ebem bie ne enso e be kan adwene kakra
e fa ho
ntino ntinaja ye de number one place to another
atwoye ntem a esi wo ho ene sabe eniama ensuo ye de ko ye sabe baby ana omugye omo na nkura ye keka na che se ensuo no di ni nyina afra ye ntin ebi kwa wonam ensuo ni mokwa na sabe wonam ewo ho it what is no health wise what was your first thoughts?
Yeah, etie for na ahwefo mechia mu nyina say the tie ne say what in some sa no a ye no in our terms na terminologies na na say a disaster into at this point you know ye ntimi nkyere say natural na man made or whatever it is you say a disaster let's put it that way and say disaster there and then ya there ade nipa bi ho beka now from what we have heard and that's just nipa be about 36 debate and it's ade 36,000
right
and about 150 communities and ade affect you so sana tie dia me feel say enye easy a tough thing a big issue now the man here big you know first of all near the displacement to say ye yomo fi baby a nanka omote right here comfortably baby so be say a human being's home near where the heart is the home or whatever it is they call it into baby a what's na fi bia free to take they see a certain period there say you displace woman who feel what sometimes we even living there and crying and crying its own right you know at the psycho you know mental emotional you be also
right
now after that you know so what journey until all we are talking about all the basic needs the basic needs of humanity and as a human beings
right
ato chuma say because shelter baby odipa ne betina no wa lose and say we lose shelter there na me very sure so say due to the fact say ontimi enkoye farms and now ontimi nkona fumu bi no obe lose baby the source of neduane nso so ontimi nkwa adwuma until the source of the livelihood ebesesa ontimi nko school until no so ebesesa bibi to community no ade a human community no in public health terms no ema nipa ye nipa no na niema so etimi affect onipa well-being and right. Health and so ni nyina ho aka say into therefore no ye nuanom no mo from Montemo hono they are going through a lot real bad times it's very unfortunate say akobanasa but then again you know, as health professionals of our level no you ain't dwelling much on the emotional even though the emotional side is very important you know the question we are asking is say what have we done to change the situation how do you transform a situation ato yerem chire sani kana yeah disaster very well so that happened this way you know now anka there has to be an immediate you know response
okay so on the health side you know who's to say the response you know it is how will you rate
in actual fact the health side no dear anka cover every response you can talk about because response you know it's a say timi cater for onipa baby or better
right
and here number one that's shelter number two no about all the basic needs and bobo so no ansana apart from food clothing shelter ni water potable and a healthy drinking water also nyana as a human being to be able to live a healthy life say be ya Arabian konkobono apart from that I will say utiminya access to sanitation sanitation, bibiara, or live hygienically, or live very well, no. And so to me, access to those materials and access systems in place. The next, healthcare delivery. Say yare sabe onipa bibi say kwensi ye kra no yare boye na bibi say esi into ba means no provision has to be made into say me in charge of public health and answer a year. The first thing I think and also be our health professional or lead some of these things now say policy wise no me advice say Ibianka government should go get Niema Maboboshi to be able to contain the situation. Because situation, you know, and yet the common conformity, the Drianene, it plays a part. But on some Abubo, it's a hierarchy near the doors.
Because my issue was, I say, we are paying attention to Abia Indiana de Comomo and Abia almost school, but maybe say. So nipa no oni apomudin papa and oni ahoden a oye dey go school and e dwere na dey akoma no kra no oni ahoden a
it's a very good question.
No when obeti
Yeah, but the point in say it was so be back out to say me na me in charge meaning say doctors were it was so be public health for in dealing with these things,
right?
Environmental health sciences for in dealing mainly with them, and sana healthcare like hospital doctors so almost the NSA about physical health, you know. Na ye treaty bibi no almost so abam but it's a health team, a whole team now also public health for organizing.
I'm surprised that Ghana Medical Association for entime enko ebi o makọ ha affronted
omo be ye omo de medical association, you know, doctors will do what doctors are meant to do because you will nipa omo they are trained and into a public health specialist level omo de omo na omo organizing events like this, making sure say bibiara health professionals be need, you know. What you say? Omuna in charge. Into medical association can go, senior consult, anybody can go. But also be organized. Say you hear makeshift systems to be how was saying labs move, you know, mobile labs, mobile clinics, mobile. What should be there?
So far, we know be.
Me can't tell much about that.
Right.
Maybe me not meant to. But say and happen here, dear, yet dear, and then now I will say to me happen because once the time is of the essence when it comes to this globe. I mean, you know, public disasters and that's health problems. So now time is of the essence, and the entire time yet, you know, said there's only a limited period to be able to recover. Maybe it's only a limited period to be protected life. Only a limited period. One say capacity needs to be good enough to be able to contain and maybe say. Now you said something about will be trying to return to
more. I mean, so former location.
Yeah, because they have the right to. So you're a human being. What do baby? Well, miss ho.
Okay.
And the ebi onyenya baby and hono esse.
Obviously.
By all means, no be say say yan so mi mudia and they will send me call back.
I mean, you have to take off yourself first.
In situations like this, no, as a behavioral scientist and psychologist, no, as well, no, I have to also think about the fact to say, behavior on the field, you know, should be behavior that can be well regulated.
Okay.
Until say ni power honomo, ye womo mo kasachira womo constantly counseling. And ye womo so mo show ma pomu den so physical side no.
Okay.
Into no or say nipa ne tiase onyanti ase. On the what tiase ne say ni home.
I say.
And
so ba say so
they all properties wo ho. E was so kohwe so betima salvage bibi. Betima nya bibi. This is what a human being when it comes to this we need choice but to think that way.
Right.
Into
yeah kwa homa no so yeah nam senior wo from Antebo. Gabriel Asempa e line so or no we this adwumadi e me no ka say or yeah ehwehwemu bi e dey afa the health implications and as assessing the health impact e wo so far e wo nkofo no so yeah kwa homa no so na ene no ekodi ego. My brother, how are you? Good afternoon. I'm good, thank you. What can you tell us or can you confirm, are the people going back to their initial location?
Yes. What I can say is that currently the victims are eager to go back to their various homes because where they are camped is not sufficient for them. According to them, there's no bed, there's no mosquito nets. There's no mosquito coil, so they are traveling there. So yesterday when I visited the place, I can see people are cleaning their various houses. People are even selling the spoiled items to scrap dealers, such as they are cooking utensils, selling belts, and what among others. So they can't wait for the flood water to recede before they will go.
All right.
That's the situation. Yeah.
Oh, okay. So can you also confirm to us whether the Public Health Directorate or the Ghana Health Service have done some fumigations around those houses or those places which are suitable for people to return?
Yeah, yesterday the Zoom Lion, in collaboration with the local government, did some irrigation throughout where the flood waters have gone. But they are now they are still irrigation some parts of the area. But to say that to ascertain how the buildings are safe for them to go back, they are yet to do that.
Okay. I mean, I am surprised, sir. There is nothing like some health outbreak be ewo. Is it because there is and a mon country and I say everybody there pay your report or pay whatever you've gathered, you know, they are well?
To the health issue, the Director General have directed that any issue concerning health, the hospital should attend to the patient even if it's not having health insurance. The only problem they are having is that they have to go far because where they have located the health centers is far from where the camps are. Some camps have chief compounds, the others did not. Let me say, like Kizito, like this, there's a health center there, and then I got to compare to there's a health center there. But the rest of the camp does not have the health center. So whatever it is, they have to travel far to have access to health. But apart from that, this is the incident. They didn't record any outbreak.
Okay. Right. Finish up.
Okay. So currently, the organizations, institutions are giving their donations day by every day. You see, like yesterday, One Vision came. Today, We Power also came.
Okay.
I am meeting with some organizations. So as for the donations about water, mattresses, rice, cooking oil, they are coming in numbers.
All right. Are the people themselves ready to get some health care? Are they ready to get some health care? Or because the distance is too far, they are not willing to go for some health care?
Please come again.
I'm asking whether the people, the residents themselves, whether they are ready to get some health care.
Yeah, they are very, very ready. Because my interaction with them is that the conditions they are, that's not how they live. They are used to their normal life. But because of the flood, they think and they camp in one place, which the movement and affecting their lives. So they are eager to go.
All right, Gabriel, thank you very much. We'll be waiting for your full report on the health issues or the health hazard of the floods coming days. We are ready for you. For nam senior from Antemo, Gabriel Asempana would say or Kasano. Yebeko Zoom na yene Dr. Kwasi Jokoto or no and deputy director Public Health Service Ghana Health Service for Volta region as a from Antemo. Obejourney or Zoom shortly na yenino edi nkita ho edi afa ni omo yedi afa ho efa apomudi ensem ho no ukọ ha omo and the subs Ghana Health Service, and even if NGOs and some benevolent societies beba ho abejourney I think said the Public Health Service and I said the Ghana Health Service no should take the major initiative. And then the body in Kitaho and check na ya sign AKOSOMBO and na kodita. But you must do any doctor again. Doc, yeah, about education. I did last week. Okay, Asamba Kwan, Mizum was one, maybe I'm a number. Hello, doctor. Good afternoon, sir. Me da say papa. Now what more to say?
Pacho be biaboko. Na mjidi sa also ho ye.
Na mi anto me ho ye pa. Na ye nuanom a wa from antemu no, o mapo mudin sem no, akosesa ye fi se eye atorenchemu ye eto omo 50 September ya ebesi October.
Yo me da say so wa mama akwanya we. Abe mama ne wetiefo nyina edi kita ho. Me jitum se wa homa na so TV e ade anipa dodo na ehwe from antemu.
Papa.
As a health service, the nya kwanya say ya infendia proper. Meda bibiara se Martin Koma mobile studio on. It say kama yie na Gabriel Asempa so ntutu ye ode ba yi. Ono so ye ne no ana edwuma wo Volta region. I am Taisha no field intimidi ye pa.
Okay.
Enti onim the yeah as a health service. Enzo Koti Director General.
Right.
Na yengina ne ona yene Director General Eco Technical Support Visit of Flamantib. Na ansa na yebedu hono trial. Ma memfa akwenya we na memma omo ahwere omo nwoma kusakuse enye adeketo na si wo Flamantib. Especially our North Tongue, South Tongue, Central Tongue.
Right.
Later on, other districts less be affected. Keta, Anglo, South Dai, North Dai, some parts of Afaja to South also affected. But the major areas, and Kameka said, Anka Atrienchen, we are home ye pan, and the tongue areas.
Right.
Anti Ansana Bibia Beshas here. Yes, among falling in Atias here say. The control spillage from the Volta River Authority. No, mudi kind boy amanye say nyame aduma. And I say abdwayi ne puma frequent mu a busumi ye twemu 15th of September.
Right.
On the dam spillage. Inti enam saying by July health service ye di kan ye the ANFN simulation exercise. Then we say DNA ebitumi yesi. Amanfo ben na nsuo betumi afa ho na nsuo form so a deɛ na yɛn so yɛ betumi ayɛ a number 1 ebe mitigate situation yɛ kasa mitigation a yɛ kyerɛ sɛ deɛ bɛyɛ obiara nhwere ne nkwa na ɛba ne saa so a secondly deɛ na yɛbɛyɛ a yɛbɛ prevent disease anaasɛ yade a etumi ekunipa no deɛ na yɛbɛyɛ a ebimba anaasɛ sɛ bakra na na we a kwakwa nyina nse nsuo no kwa manfo be den asan ko omfie ho nti by 12th of October you say nsuo no edru be bia esa manfo firi omfie no ade e fe no risk assessment nti no people from the various technical disciplines a free be epidemiologist or more say yariwa intikiti ebeso almost spread your mom ye ho aduma say be ya enkunipa na say en spread health promotion or more ne aman nyina edi nkomo ntawo wan say dey say ombesi abo omobra sana omunya yare bia lab for specialized in medical laboratory sciences, surveillance officers. Yeng na a regional director of health service the and acquire research assessment. Na the no gidi say mo kan ngina studio. Edikan no at the time 12 October na people 20,000 are displaced.
Are you saying say are you saying say because of this risk assessment here mo get before na na up to now yente any outbreak bia ewo ho na na
Ningina aka mpempi no se ebia yare bia mba na se monte se amanfo enje omonto arasabia anasa amanfo nhwiri omunka mun se doctor for ya share lab coat ayi kumrika na ya na bebre na adwen se ne enye edwuma bia enye sa na tie edwuma ye se di kan yem ene se ni se yade no kra eba it a risk assessment ye need eni so ade ehun ne se ye be bibia se de be ya yade no enyi di tikra it a risk assessment ni ehun se issue on be no mu no ha adwene kakra esan say unexpectedly loka aveyime on off tongue.
Right.
Water supply system it was interrupted by the flood. In the next you be end. Amount for bebrina and an from fie. Now if we be safe haven, a honor was rock account is your name. Now nipa pim 5,000 and now more 15 safe havens. Our north tongue nkwa and sana was up central tongue. And so nipa mpim be 2,000 and some of south tongue another close to 3,000 or 4,000. So this was the situation. Health services was disrupted. As a onifie inti oyade anka clinica eso konontumi nko na clinic ewo ne poto emu no also eno so nsuafo. Right. Na hospital back a friend Richard Novati Hospital, Komboni Hospital was Sugakofre, and also Ensue Yironyina 51 health workers, and I ensue Yoma, insurance say, or Mumium Megina, na the S or her amount for no mum, or how na one of the best age man. Right. And after this risk assessment, what did we do? I mean, that is the most important thing. Yeah, the regional environmental health promotion, regional environmental health officer. Any VRA not ingna yedin ta ho ne akase da bi we de wash protocols you can wash that you can potable water ensure yetumi no ensure yetumi adinu aduane ensure yetumi dware ensure odube si nyoma ensure yetumi bibia chese ebe manipa ho atin ehia ye. So we raised the alarm, and then people supply of water from VRA, from NADMO, from individual benevolent institutions and organizations. Some not shown by on the best acute water shortage now. And no children assembly no so modern and restore water situation about normalcy, but still there were still displaced people. Your donations have been very helpful. Right.
May call short break, but I mean, say, say some of the victims, almost to say, VR, they better just say almost pele a year in Sony beam, and so no akofom or mupotem no more, and sana. I mean, maybe number one at Toyantamisi and they say no, or higher conducive for them to go back health-wise, or Ghana Health Service, most to say conducive for them, so back to a more previous location, Anna.
We have to look at it at a case-by-case basis. A bit more how much me up, a bit more or her, and nay, almost me. Okay. SA assessment. Okay. SA risk assessment, and sana omwe to me up. It's any assembly, not any a one on waka. Edin kuda ho yene amam for so edin kuda said ye be ya atriyenche bia nkoto. Okay. We have been past the worst. In this recovery phase, we are asking for cooperation. Obi amboye said the be ya obi anhwere. All
right. Now me guest was studio say anka ye bi to say mobile clinic and a mobile hospital bia. You bring the hospital to the people knowing say some of them are affected or multi distance no ewa. Are we doing that?
Mpacho, yeah. 15 safe havens thing in our medical teams are even at the acute phase. Me po GMA for Abaso. Okay. A home say health workers, health promotion officers, surveillance officers, doctors or more Bato Catholic Hospital, Sukakopa District Hospital, Adidome Hospital, NA Richard Novati Hospital, but Ghana Medical Association, somewhere here. Okay. The doctors, every other areas, and more Juma will safe havens, together with our staff who are already in the district. Ghana Registered Nurses and Midwifery Association, Psychology Association, Mental Health Authority. They all supply personnel to these safe havens to support At every single day, no, yene amount for health education, show mo screening, they identify people who are vulnerable. It is our many in our safe havens. And now we have skeletal teams there, or almost so it will so here will escalate it and send more health workers to those areas. Said Yabeya, Yadieno, Yadie, Bonibia, and Cambia.
All right, finally, you said there was some emergency health policy there. Say BBS say ya, you bet me a follow on Anna. And I said this one, and I be to emergency health policy.
I said COVID-19, no? Now a major health emergency across the globe.
Right.
2 years, the health service was almost in emergency mode. So the structures were built, capacity was built, our emergency preparedness and response capacity was built. The plans ningina edaho. Now, some of disaster management committee are not muda, almost a disaster plan, and also health service. So the structures are there.
Okay.
Your emergency operations center operates 24 hours. And for every disaster that we get, I can say that largely we have the capacity to deal with it. Then, so the America can say for every disaster, we learn new things so that we get better.
Right.
And we will not say that it is a perfect system. Then, so your boy who modern Piera say, day in, day out, will better deliver on our mandate as a service and as a people.
Mr. Jokoto, where are you operating from? Oh, operating from Accra and Volta region.
Me operating from Volta region. Me Deputy Director Public Health for the Volta region.
Okay.
Now, from the outset, they be the districts now. At Rianchem, we are 2 women. South Tongue, North Tongue, and then Central Tongue, as well as Keta, Anglo, South Die. So we go around, monitor, ensure. Say Bibia Ekoyi, the Director General on time. So also Abba only Abe Juma 2 days because he wants to personally supervise and ensure that all the interventions are in place. The Director of Public Health, Dr. Franklin, said we are moving in COVID-19 also Abba ICD, your share clinical care organ and na said Yebeya, a man Bekoswa, among now be
all right. Dr. Jokoto, may I ask pastor what you remember? I mean, it's our last question because I am director Simoti Accra, na ma report. It's a more from any AKOSOMBO na mo beka obi kana some book mo bro for chance. So I'm happy say you are in the Volta region now. Wako this sentence here okay. I'm happy say what to me ayasa. Yeah, but my boss somebody to me aye adwuma no bebre. So na be ya apart from the atu omu ebi ensign and to omu eka apomudi ensem ho. Dr. Kwesi Jokoto, Deputy Director, Public Health Service, Ghana Health Service, from Mantemono, and then it was Zoom. Make sure you tell your bar. My guest was studio Dr. Richard Egan, or public health consultant, global public health consultant. I don't know everything. I remember I was waiting a friend. Now I didn't check a crowd or no. More Volta region, more show your mom frey. Nay, who says son of a panic and I know correct. Say near to no cost mobile clinic and a be bamo hall and answer or campu kumbrofo and I say you try on your masses here. Abusa for go so ahwe ensem esisi wo original TV so ene ye share ensunsa so a flooding and asatoye nchema na VR for omo mete bansa omo ebiebie yenti no de atoye ntem ekoma atemamufo a ewo eye from Mantam Potemo bi no me a health director, deputy health director at the Ghana Health Service ewo eye from Mantam na din kita ho ye ba studio there me guest for studio Dr. Richard Ega ye can public health service globally papa edima kotepa doc ututu say baby na omo wa to yentam ne sie no aye okay for some be ko back na
yo I'm say the chairman say deputy public health director no akasa I think say near say public health ni bia ye no ma ye no because they are doing monitoring surveillance your risk assessment ye BBS say and I think so there's some intervention. These are our terms, so you soon meaning say BB is happening.
Okay.
Once yes Dr. Jokoto Canadian not just say measures are in place. And said of can so no COVID by a coenche in Shishaya normal no. These are in Shishaya they manage disaster in terms of health services so much more. Now, I think it's going back to the place.
Right, right.
I really wish, and I hope they will invite some of us to come to the place. And I say, because logistics-wise,
for
we
some
hope
independent assessment.
For assessment and visa, because per se, then for Ghana, Ghana, na me feel Britain Abba has to say on my holiday, and me
right.
Now, the attorney said, meaning said they are trying their best. Once they get BB out, it's kind of there.
Right.
And it says, Sika or Honomodia, and Kameme, we should say, the capacity to contain. In fact, a be preventing per se, a buying be declare state of emergency.
Oh, so you are in support?
No, I would be in support if measures are honor. And yet enough about send me to on the so far so much contain situation to a point whereby at least you need to be put one far more person call back there and then a be and then who here somebody declare state of emergency but then so health professionals no directors no ne Ghana Health Service in Pennsylvania there and a be informal position decision because government in the be kasa e be general directors here obi baakobe kasa see any there the end be decide say e be buying by policy ye decide say declare it won't you mean declare until say ye be can chain say the access here dru ne hunu say the dru ne there ye ntimi contain they say enye maybe but say na Dr. Ekan say to prevent, which is one of the things we do in terms of public and global health, prevention of disease, prolonging of life, promotion of health, etc., etc. And surveillance through monitoring, surveillance, and so on and so forth. But to prevent disease, or an outbreak, if you say on the ground, I wish I would have been there too. Also, Sanye, Dr. Jokoto saw on the ground to see for himself what he's seeing.
What is stopping you? Get in touch
Why not?
with them.
I would like them to actually invite us on board. Yeah, diasporans.
Oh, so more group of doctors.
Me individual, me so me back every time. Ghana. I don't even know whether they even know me. But yeah, back me or TV so most of the time.
Me program
well, that's fine. They have to also see say
right.
Say you question say you better advise you nianom. The omunim omo share. The ensu enim ye be share.
It's again. Do you think say no baby no more that no ye health wise some of
in fact say me ma assess there say me ko no ma kwhwe baby no mo tie dada no a.
Right.
I make him advice whether say, oh, it's conducive, you use that word.
Right.
Say, sign aba. And now say, make us say, no. So, ba, bia, there are hidden in near maybe or no more. Because at this point, a fumigate here, and no, a different thing.
Right.
But removing of stench, because Matisse say, Ghana, they say open defecation, be crying, and shut to draw man into open defecation quite a common thing in the country. Into sanitation wise and hygiene wise when it comes to these things now in behavioral sciences say we have to control human behavior, regulate it. Now say beya omon form to situation be a worsen because they say they are even about to pass the worst because since we almost say recede. It's natural say ehunu kra free so dodo no mu kra no eswate Into they are about to pass the worst. But they bear yada say, if you call the same place again. Yes, doctor say the risk assessment.
Right.
Take be public health there. One of the things also we to assess situations to prevent disease, to prevent epidemiological issues. Or mention that. Epidemiologists, I believe they are there. So omo he say, inti omo kwa population do say na omo kono. Ombe okay. Because ye enyema be free ho. Stench, ye say enyema be fry. A born kwa bibi be born for so no betima ma yare.
Doc, my family number no and Jana, ye interest etiefo ampese omo contributing no omo contributing na yentimi enjoy last week na nkofo ba hye me wo Facebook akra omo ba me die ma say ma omo kwan ma omo ankasa na say PR Ghana education so no be so omo come adwe che no pa na nya me alliance no ya na drop nti e the line no phone number no ato screen so free me so fra no reduce volume no yetimi ene wo edi nkita ho wo studio ye bra back it doc to say fumigation no anya enough.
Fumigation depends on the objective. Bibia ye bia na definitions wo ho. The nipa no no. The objective ne say ye kumudien. Ye fumigate ye reduce the na ye affect microbes and say den until you see a shade ye fumigate exactly what they did and whatever it is that was involved. Chemicals, there are different types of chemicals to be used in terms of fumigation. Into fumigation, yes, fumigation say ye dibe kum bibiara ewo ensuom ana ewo enuenue bi esisi hoso ana ewo adan mu. What we don't know is what I'm just saying. Because the mimi nim no ye adan mu ye ensuo so na ye de kogugu ye eye Now what was the objective? Ye di go so say be ya omo betimi akoback aboni bi ankoka omo.
Right.
Objective ni important. Ye nim yet I don't know. Into me we she say I also put my number down in case there's almost super so many kasa.
Right.
Na me so be ntibi na kakra ye nyina de be share. Ye ya mahanum se be condemn. Ye ba ha se ye be contribute as Ghanaians. Into no.
But what is wrong is wrong. If
what is wrong? We say be a wrong there. Into the air can question say fumigation, you know. And then no objective, no. Say a yensuo no ye spray so a. Ye spray say ye bitima nom. Say ye dan ye fumigate ya ye kum and more bit rodents in your ma abehedi snakes by almost so take opportunity. Because Abani say na almost super baby baby atete. Into someone so yentimi nyomo because on problems. Scorpions, anything can be there, be hidden there. Into no tin ye be sadia. And the natural say ye ma omo enya idea. See a fumigated ya omo ba enya idea be say oh ya ye we inti. Into a person health, especially public health for health promotion, environmentalists should actually explain to them why side fumigation was done, what objective was. So by means oh yeah
fumigating everything is fine.
BI is fine. That's what I'm trying to say.
Right.
A bad is saying na behavior and here say about regulating behavior. Say na be oh menko ya cordon ha say obi anwura ha. One of the things we do, cordon off certain areas. I had a yengura, no one explain why. So that the people may not think, say, what bahon mo be show so. That's another thing, so as psychology, you know. Oh yeah, pa, then a bedroom stage, you know, there will be an outbreak of trouble. Maybe an outbreak of disease. But I have fed up. And the moment baby, papa me and me say any outbreak of trouble, chaos. Ain't I was here regulating all these things. The more we do what we do, in terms of public health, global health, the more we try to put structures. Because they say, you know, shelter here power. Shelter there, say, yenye be there.
You say, mono, now can you say, your mom san come back a crana.
Median can at the moment, the can me feel say, and momuno say, your camps, protected camps, obi antiming will be being koye obi bone. Because Abani says so. One of the things we protect and prevent a crime. Into no set baby, a dear more corner so should be a place. Sabi omo adeja ne ade o jonso a obi nhwe de wo ye the fact is exactly the fact is say oh yeah the other day no be can see one mattress. Now somebody was telling us this now and nipa be 5 for a family into say no omo nyina ntimi na so no omo da ho no omo di dia toto so te sesum ye no matter for mattress inti say e ba ne say na human dignity be ko form kakra but to some extent no so yetimi prevent say enye too much ema enipa ba ne be man na the same toilet so ne side inti in a way no shelter is very important inti you see yi omu fi mpacho to the trauma ne when say psychologically no omo hu niema ye hu inti trauma no ne say ye be yi omu fi sa environment no kakra inti going back ne be kai omo niema too much at this point and thinking about omu nia no mo kro omu ntimi embe join ni omo ne ade no kra de insane bebre beba inti no classrooms ne ade ne de anka say temporary measures
mama me say finally say na kan no behavioral aspects of it obi wo ha ho na ye wo no ho na onima it's moving to a next place no e bad man psychologically how do you tell the person say no asai so enye okay for nipa so betina ha wapomudin no how do we talk to these people
mama say say onipa no ti ase say eniema ekoso ne akoso no ne niema aye first of all ensuo kra na ohoro ntimi nsabi nomo da se kane no nanka utimi ko sabi nom e de horade a at this point in time no ensuo no asay enti niema e wo mu nye enti na me bisa say fumigation ne objective ne purpose ne de wan no enti niema nye enti ukọ hɔ a ensuo eho be yi ene ya camp mo ba bi say be nya access to you the whole free camp no more getting to you no access is very important access to people, access to roads, access to healthcare, access to sanitation, access to food, access to water, drinking water, and also healthy water. Into access no ne ye dwene won say ukọ hye ho no mo a would people like to go there if you would canoe na ekọ sa place no yenso so ye feel say if your health officer bi kro ho mo ndware nsoda obi o kwa enso kra wo hu na ne yem sese no obi o ye hydrophobic
and because of that there will be some shortage of health personnel
over there because obi o soro nso pa naturally nti we na ba ne sa no ye camp omo well camp de emudu ye nya shelter o baby safe haven bia o metima shawo kakra na ye de ayede ye nyina say 2 weeks adibe how many weeks now?
No, it's about a month now.
Very good. Into by a month ne de me dempo say outbreak bi am my. Now outbreak in by because health professionals no are doing a good job to really control behavior.
Is there a possible post outbreak?
It could. I mean post traumatic issues beba. Post trauma psychologically beba. And me be be see. And also no say yentimi and fumigate area be associated with the necessary your friend saying agents a betimi overcome bibiara happen within disaster of this nature no ne areas ne dia it means that for a very long time and maybe will be lacking ne maybe be wo ho na sa niema no na be expose betimi expose nipa bi to conditions like cholera which Ghana had yenka
okay
yeah
all right media director catch say they have issues with phone lines. It's where nyamia me the director no picture and then a number but to me Facebook. Now mo na kasa nyamia me de me mama time some be kasa or say me nim de nti aye site with the phone. Me the number and then the picture but to na ma hwe why. Na mo hu de nti oye me sa. I was for how dey do be see our original TV so amenda Dr. Richard.
In case say
right.
The finally we are trying to say dear omo ye me believe say disease in outbreak in my dear then the health service is doing a good job.
Right.
I believe they are doing their very best.
We want to support.
We want to support in any time Obi biara so pay any consultation with us. I do global health consult. 0595 23 4695 0595 23 4695 and also WhatsApp here 057 63 00552 057 63 057 63 552. When you contact me, anything I have to share, because you see, there are I was here. I said disease outbreak.
Emma post disease
outbreak. We'll try our best.
Dr. Richard Egnan, a global public health consultant. Odini Juma, ewo UK amana no ya na oba Ghana sa na ya che na beta na wa cheche yensem dada ya da se wo je bread na wo so me na ya correspondent wo Volta region Asempa Gabriel ase na deputy director for health ewo Volta region Dr. Kwesi Jokoto madam team ni nyina ase Reggie Prince Sami 4K any obi aboy any Hayford azay certain way with the man dey make us in the actual that's na your message here original TV so bye bye thank you